Okay. Hello, as you know, Dr. Daniel Cameron. Um, you all know because you're all here, so thank you very much. My family was, they've seen me work, seen me write, seen me do lots of things, and they wanted to have me have a official book launch. And since we have an office, I'm so happy to be in and be able to practice. They just thought, why don't we just work together as a family and put it, get a lot of friends together and supporters together and do this a book launch here rather than just an official bookstore. So so that's really so thankful for that. So I wanted to tell you that writing this book is took a lot of work and but I want and a lot of determination, a lot of stubbornness to keep writing, keep writing, keep writing. But I want to go back in time. I want to go back in time to like when did I start being this determined and this stubborn? And so I look back over time, and the earliest recall of being stubborn and determined was when I was 8, and my cousin was 9, and he has to get his cow ready to show at the state fair. So you know how stubborn Angus cow is, and so then I'd spend a lot of time in the spring trying to get that cow to move. He'd pull and I'd push, and they wouldn't move, and I didn't have much weight, and so I would, push into one knee with my knee, and push into the other knee, keep moving 1 foot at a time, then get in the backside and push again, and so I would spend hours, days, weeks, and months that year. That cow wasn't going to get the best of me. So that stubbornness continued. I didn't really always know. As a kid, you don't know how stubborn you are. So when I went to medical school, I had thought geriatrics. There's a lot of things about geriatrics that I didn't like. A lot of things that didn't seem right for the elderly. It was the earlier times where the respect for the elderly people I knew and grew up with wasn't there, and I stubbornly kept working to support the aged, support geriatrics. I went to graduate school to not only just push for better work in geriatrics, but I really wanted to get a graduate degree in the School of Public Health in epidemiology so I could learn how to not only be stubborn, but learn how to write and learn how to do study designs and learn how to do all those things. So then my first job in geriatrics was an Alzheimer's unit, director of an Alzheimer's unit, which was great. But I thought I should stubbornly get out of the nursing home and into the community, and that's why I came to Mount Kisco. So here, I had 3 Lyme patients that first year, and they weren't getting better. Doxycycline was all they were getting. Everything wasn't going well. So one of them I convinced to go to Boston to see Dr. Steer, who had written about Lyme. And Dr. Steer said, well, why don't you use amoxicillin instead of doxycycline? So it seemed pretty logical at the time. And so it shows how little I knew. I never learned anything in medical school about Lyme. And so sticking with Lyme, there were so many things that weren't right. And so that stubbornness that I knew from age 8 seemed to come in handy to take on Lyme. And here, 31 years later, I'm still in Mount Kisco, not happy with everything that's being done, and still trying to get justice for patients that are in my practice that I take care of. I write a lot because not only I do what I do in my office, but my family supports me. So when I go home, I tend to read a lot. I was fortunate enough to start writing a series of blogs, science blogs, where I read an article from literature, from a scientist who spent this amount of time writing, publishing, their whole careers on it. But how do I read that article? And how do I interpret that article? How does it help me in my practice? How does it help me with my patients? And so I found that after 150 of those science blogs, that's where the inspiration came from the book. It's very hard to read more than like 1 or 2 of those science blogs, on the fly on your computer. And I thought, why don't I take all the science blogs and talk about the science of Lyme, what I like, what I don't like, what's actually happening in the tick, what's actually in tests and treatments, and what isn't happening. So that's why that book, which I'll be signing shortly. But when I look at that book, you know, I often go with that book and go to a book signing at a bookstore. But I thought reading from the book that's one format at a bookstore. But often with the new social media and everything else is when I stubbornly, continue to work on how to do social media. So how to start an Instagram account. My daughter pushed hard to get that going, which is going well. Facebook, and this is today we're trying live Facebook for the first time. I've been continuing to what I call Lyme disease science conversations. So every other Tuesday I finish 10 sessions where I take on issues like teen Lyme, all the issues of adolescents that I've learned in my practice, what's been published, one on anger, extreme irritability in Lyme, based on patients I've seen, in the book, I guess in my lobby there's a book named Rage, and a movie, a little short clip on my website, and it's so much to learn about irritability and rage just to go through that topic. I did one on post-treatment Lyme disease syndrome, the good, the bad, and ugly parts. I don't like post-treatment because it implies treatment's gone. I mean, the treatment's done, that there's no value of antibiotics, and they call it a syndrome. They don't even calling it a disease or an infection. So I found that those formats using Instagram, all the other social media, Facebook, allows me to communicate not just what's in the book by written word, but why not do a conversation and why not grow with social media and those kind of things. So that's been consuming, but it's a reflection of that stubbornness that I had seen glimpses of as a kid. So I wanted to read from one of the chapters in the book. Can I use your book for a second? Thank you. Just for a second, just to give you a sense of it. So what I did was take like this particular. It's in sort of the back of the book called Preview 3. It's it has to do with congenital transmission of babesia. That is, normally we always think of babesia because you get a tick bite, and it's your own exposure, your pet brought the tick in, you have those kind of problems. But congenital means you got it because your mother was pregnant, and you just happened to get Lyme through the mother's exposure. So in this case, it says congenital babesia is considered a rare disease with only 9 cases reported in the United States, all in the Northeast region where babesia is endemic. So this is from the Journal of Pediatric Infectious Disease Society. So that's going out to the society for them to discuss the issues. But there are so many new cases that never make it in the literature. Every time I see something in literature like that, I think it's quite informative. So in this case, that there were 2 infants that were born to mothers who were pregnant. And what they did was the mother was pregnant, and in the 3rd trimester, the mother had a rash, got treated for Lyme, the baby did well. It's just then when the baby returned that the baby was sick with babesia. And so it said the first infant was 4.5-year-old male. He came in on his follow-up visits. It did well when he was delivered, but he had a fever of 101.7, sleepiness, periodic irritability. Now, I don't know if you know what periodic irritability is for a newborn versus an illness, but but they seemed to have the radar up because the mother had Lyme. The mother had been diagnosed at 32 weeks. So that was interesting because we always think of, and I always think of when you get Lyme, all of the diseases happen at once. In this case, the Lyme occurred at 32 weeks, but the kid developed the babesia part later. Like it looked like at least a couple months later. So it shows, in my practice, I always see somebody ill with a rash. Then they come back a month or two later ill. And so it reminds me of what happens with babesia is part of the story. The doxycycline I got for Lyme took care of the Lyme, but not the babesia. So I thought this was a great reminder that babesia is one of those things that doesn't always occur at the same time as Lyme disease. The second mother developed a erythema migrans rash at 37 weeks, treated with amoxicillin. The baby was born 3 weeks later. In this case, it was somewhat interesting that the baby had a PCR positive for babesia. That is, there was some evidence of babesia, but there's a feeling in medicine that babesia is asymptomatic. Some people think, well, you're not really that sick. Nothing much is happening, and so they decided to let it go and not treat the baby. So later on, at 18 days after discharge, the baby came in with hospitalized and with significant amount of anemia, malaise, tachycardia. They had to give a blood transfusion. The parasites were still high. And so they had to treat for 14 days. In this case, the babesia was one of those diseases where you can't get better with doxycycline. You have to use things like Mepron. The generic name is called Trobacone, and Zithromax. Now, I tend to use the lower dose Malarone, the pill version, with a lower dose, and it seems to work quite well in practice. They use the full dose Trobacone. So in this case, is that I wrote 4 questions that seem to come to mind after reading this article. So I want to read these 4 questions because they're not resolved. One is, could babesia in the first and second trimester lead to complications or death in utero? Because we have the first trimester, the baby's not going to be born until after the babesia pops up. Second trimester, same way. Is that we don't tend to treat pregnant women for babesia. Would doctors recognize babesia in a pregnant woman or infant if you didn't have a rash? So if they didn't have that erythema migrans rash that these 2 pregnant women have, and they just had babesia or just didn't have a rash, would those 2 children have gotten treated? Would the complications and need for transfusion for the second infant have been prevented if the child had been treated at the time of the PCR? If doctors had said, well, if you have a positive PCR, you didn't look that sick, but how are you going to know what a newborn kid's total condition is? Because they can't give you any symptoms anyway. And the last question I posed in this science blog is, should women presenting with Lyme disease during their pregnancy be treated with a regimen that's effective for Lyme and babesia? So it raises a question. This doesn't completely resolve it. But I thought there's so much we know from our own experiences and friends, families, and social media, what you read in the literature, everything you all read, is that articles like this allowed me to get into the weeds, into the bushes, and really, really carefully learn what I can from an article, because the scientists went to a lot of work to describe these 2 pregnant women in the 3rd trimester and what happened. And I think that's why with this book, Lyme Disease Takes Our Medicine, was dear to me, because it allows me to go ahead and have more thought-provoking type discussions rather than just simple, oh yeah, well, I guess it's babesia, and you just treat doxycycline for 21 days and that's it. So I think I wanted to pull out one other article on Babesia also. And this was preview 2. Blood donor infects premature infants with Babesia. There was a team of researchers at Yale School of Medicine. They had 3 premature infants, all in one neonatal intensive care unit. But all 3 of these infants got Babesia from a donor. There was a 24-year-old blood donor, and who unknowingly donated blood. The blood all went to this one Yale center, and they developed Babesia. Now, it says here the screening questionnaires for Babesia from blood are not as good as we'd like. The blood tests are still being worked on, so they can pick it up to some degree. But in this case, the kid didn't even know when he donated the blood that he had Babesia. It was only when these newborn in the neonatal intensive care unit were getting the transfusion. So the parasites rose to 13.4% of the red cells in one child, and another child, 12.5% of the red cells had Babesia in there. Babesia only stays in the red blood cells for a brief period of time, then it seems to go into the tissues. And so in this case, because it's fresh and they were able to recognize it. The third baby had 6.8% of the red cells had Babesia. So they were going to use clindamycin and quinine, but they weren't sure that newborn nursery that they could use that particular drug, so they used the Trovicone and Citromax successfully. So that the authors warned of the difficulties with Babesia, capturing Babesia, working with Babesia in this newborn nursery, because a lot of the symptoms of Babesia could have been the same symptoms as a premature child in newborn nursery. So with the 3 questions I asked, and then I'll close on this part of the program, is would longer initial treatment have prevented a relapse? Because one of the kids got treated with this bandage. So if 1 out of 3 relapse, the question is 10 days of treatment enough? I don't think so. What were the consequences for the infants if the Babesia was not detected by a tick smear? If the Babesia disappeared before they detected it? And how do doctors are they sure the Babesia is cleared when the parasites go away? And so, I thanks for the book. But this process of stubbornly going ahead and trying to work with Lyme, I decided to more narrow down to a particular article and use what's there. And there's so much to learn, and so that by writing the book, that helps. Doing these Tuesday Lyme disease science conversations helps me elaborate in more detail what's in these chapters, and I work a lot with social media to also try to make the science of Lyme disease come to life. So you know, when you're sitting there trying to figure what happened to my family, what happened to my child or grandmother, you can see scientists are working on it, but how do you translate what they're working on to something that you can understand? So that's why I wanted to give you a little bit of, like, in a book reading capacity here, some of the things that are possible with this type of reading. So I wanted to open it up to any kind of questions or comments that someone has, because we're going to do a book, get on with the book signing in a few minutes. So go ahead.
In the first case, the mother, was she treated or not treated?
She was treated. Both of them presented with an EM rash.
Oh,
both got treated with a simple amoxicillin format, and they thought the mother was okay. They thought the child was okay. It was delivered. It's just after delivery when they came for a follow-up visit. But they probably had their radar up, because if they knew the mother had Lyme, the mother was probably asking questions, and so they probably got more surveillance than you would if the mother never had a rash.
My question is, did you have subsequent pregnancies? Would the subsequent babies be at risk?
It's hard to tell how long Babesia is in the system because I wrote a different science blog, and there were maybe 60 people in New York that only knew they had Babesia because they donated blood. So it's not a rare occurrence. So that because the tests aren't so good, we really don't know how many people are running around with Babesia that's not known.
Right.
And it's so we need better tests. Until then, if I find so many people with Babesia are actually sick, they're not asymptomatic. They actually have problems quite often. In fact, if somebody's still having problems with Lyme, often I'll look a second time that Babesia might be the reason the doxycycline or amoxicillin is not working.
Thank you.
Back there.
I was diagnosed with Lyme's and babesiosis back in August of last year, and the reason why I'm wearing sunglasses is because I can't handle the light, and I changed doctors, and he ordered a brain MRI, and nothing showed up on the white matter, but I have concentration issues, and I kind of act like I have Alzheimer's. So my question to you, and also I have extreme ringing in my ears. Is ringing in the ears part of babesiosis?
Yes, ringing in the ear and hearing loss. I wrote a recent science blog on how frequent that is in one center. The other reason I wrote about that blog is that there's hardly anybody actually looking at ear ringing and hearing loss. I find that quite a few people get better, but not everybody. Now, back to the memory. It's often more of a processing issue. That the information's there, it just doesn't come out at your disposal very quickly. So it's some people refer to it as a Lyme fog, and neuropsych people can measure that processing. It just doesn't come up very fast. The words don't come up very fast. Can't be counting on facts so easily, and so it's just because the MRI doesn't show it, it's still an important process. I did a Lyme disease science conversation on dementia and memory loss and how similar they are. And since I was an Alzheimer's specialist at one point, now I've been Lyme expert for 31 years. It's interesting when similar issues come up, where the details and the scrutiny is important, not to jump to conclusions that it's dementia so readily. Yes.
Have been any cure for Lyme disease?
Well, there's quite a range. Did you finish your question?
Lately, that's all.
I think that the drugs that I use are the same drugs I've been using for probably the last 20 years, maybe 25 years. What I find is that there's so many people out there with Lyme who are looking out for friends and family that I get them to the office quicker than I used to. I use something for Babesia quicker than I used to. And I look for it more promptly. I find that I use more pills much more readily right up front than I would intravenous. And so I think it's more of being organized. It's also, I find, important if they're still sick after a month to include other specialists to make sure it's nothing else or some other comorbidity at the same time. So I'm regularly, from the very first visit, the second visit, looking at, yes, Lyme is a possibility, Tick-Borne, but is there something else that explains it? So, but the most important thing is you got to get better. No matter who gets you better. I always try to stay away from sugar and alcohol, and that always seems to help with the symptoms a great deal. Take probiotics to try to help the stomach. Stay out of the sun with doxycycline. Eat with doxycycline just to protect the stomach. But a cure is tricky because anybody that's been really sick and has had so much troubles with getting better has emotionally, symptom-wise, everything else is so intense that they'll still have some times as they're getting better where they can't believe how big a flare-up it is. And so they get nervous about the word cure because some people stay well, and some people get such a flare up that they get pretty scared and pretty unnerved by how complicated it gets. Question?
So the symptoms are so wide range for Lyme disease that they're like, is it possible that there will ever be just one cure? Because everyone experiences it so differently that like everyone responds to the treatment differently also. So isn't it like still a pathway to finding cures?
Well, there's two parts to that question. It's a great question. One of the problems is that every time they look at a tick, they find more things in a tick. And so they originally had like Lyme, Ehrlichia, anaplasmosis, and babesia, which is a parasite. Then they found that the same Bartonella showing up in a cat. Cat's red fever seems to be showing up in some of the tick illnesses. And that seemed to be bad enough as it was. Then the CDC pointed out that there's another 7 diseases in a tick that have been recognized since 2002. So there's quite a range of things. Even Borrelia miyamotoi, which is, they thought it was just in a tick, it was just hanging around, it was a symbiotic relationship, they just got along, and they found that was a disease also. So it's going to be hard to have one treatment that's going to take care of one person, so that's why that's complicated. But the other question I asked is that everybody seems different, but what I find is that there's some commonality also. So that the immune system, the cytokines, the chemokines that are way over the top are driving the immune system so people feel drained, exhausted. Every neurotransmitter tends to be up to a high, so that's why this rage, the anxiety, the sadness can pop up from time to time. They're wired so they can't sleep. They can't think and process very well. They have head pressure here, the lightheaded when they get up too quick because their adrenaline's too high. They sometimes have tingling in their hands and feet. So, but the reason why that was a great question you had is that everybody has their own package that seems to be which ones are the most important, and so that there's some commonality as a doctor, and so I'm always trying to like. If there's like 10 arrows that are all pointing toward Lyme, and then if 2 that aren't, I just make sure I don't forget about all those arrows pointing toward the Tick-Borne. I still look for other diseases, but it can be seem different, and it also seems like somebody's so sick sometimes that they feel that they're the only one that can be that sick. Nobody can be that and have that much troubles. How can anybody be that way? Because it's so deep-seated that it affects the mood, the fatigue, the sleep so much that it can be overwhelming. But when you get somebody better, you get them under control, it's such a great feeling to the patient, but it's also very satisfying as a doctor to find something that works and nail it. It's like, I'm always surprised when so many doctors overlook that opportunity to really make a difference. Any other questions or thoughts? Yeah.
Did you ever have a patient that you treated where you sent for stem cell therapy or ozone therapy or anything like that?
Well, there's a broad range of therapies beyond antibiotics. So I read extensively, like the ozone, the stem cells, and alternative medicine. But I do so well with what I do, so I'm more of an allopathic doctor. So that I do so well with this that I don't really do those kinds of things yet. But some of my patients and some that I hear about try those things. It's when you try to look at the evidence, often there's not enough to be very satisfying. So you end up having to go on testimonials, and that's not enough detail. So I tend to focus more on where it is that I can do the best. I also do so much counseling because it's so hard emotionally to be that way. And so I find instead of less supplements and spending time on what to take, what not to take, I do really well with making sure I spend so much of the integral counseling, guiding, behavioral kind of modification, trying to deal with how do you work, how do you go to school, how do you get back on your track with the school district, how do you be a mom, how do you be a dad. All those things are difficult when you have when you're in the beginning of the illness. But the exact details on those, I couldn't give you those details on them. I read them. Thanks. Yes.
Yeah, your antibiotic treatment, is the ultimate goal to get off of antibiotic ultimately? Or it's like an ongoing process? You've got to continue with the antibiotic to stay seemingly well.
Well, the question is, do you have then antibiotics to just hold your own? I find that that most of the patients I take care of, the goal is to finish up the antibiotics, simplest regimen you can get. Try to do it with antibiotics if you can. That's why that earlier question was useful in that doesn't mean everybody gets better. And they're always seeking some of the uncharted treatments. But I find that there's a lot of turnover in my practice because when people get better, they don't even see me anymore. But some come back, and so it's then you wonder how long to work with them because emotionally they might do quite a bit also. So I try to as I'm working on get rid of symptoms, I try to work on how do they recover their life, get their life back. How can they add more things in life? How can they deal with the fact that they have some flares, but still they want to get their life back?
I wanted to just pause for a little bit. You guys want to get something in your stomach, and then we can continue. Is that okay?
Well, I think we're at a good spot anyway because we'll do the book signing.
Yep.
And just I'll
And
be
then
able
we'll
to
plan
answer
on
some
the
questions and
right?
those kind of things.
Great.
Yeah, Kenny says a couple other things that she has plans, but we got this part of the program done. I really appreciate your attention on being able to read from the book and share with this path I've been on for years. So thank you very much for that.